Catch and span evidence helped Texas Senator Jane Nelson and Comptroller Susan Combs, our Texas patron saints, establish child and adolescent obesity as a priority that needs to be addressed using evidence-based programs. As an example, in 2007, Comptroller Combs provided funding for implementation of Senate Bill 42, which mandated coordinated health programs in middle schools. Comptroller Combs's funding enabled low-income middle schools to purchase PE and nutrition materials and equipment. Since Texas Senate Bill 19 was passed in 2001, catch and span data have been instrumental in providing evidence and support for school health policies in the state, along with other stakeholders such as the Partnership for a Healthy Texas. Catch has been widely evaluated in Texas. In the early 2000s, the El Paso area of Texas participated in an 8-year Catch initiative, which was funded and implemented by the Paso del Norte Health Foundation. The efforts of the El Paso initiative included community-based and led interventions, legislation through Senate Bills 19 and 1357, policy implementation of the Texas Public School Nutrition Policy, which regulated foods served in schools, and regional media campaigns, which provided messages that reinforced the school health efforts, which were ongoing. These efforts culminated in a 7% percentage point decrease in obesity for fourth grade children. This effort is noteworthy in that the area in which this decrease occurred is a big area. For example, Public Health Regions 9 and 10, the areas that are highlighted on the map alone, are equivalent in population size to South Dakota and Wyoming combined. Based on the success of El Paso, the Michael and Susan Dell Foundation funded a catch initiative in low-income Travis County elementary schools to continue evaluation and improvement of catch. In this study, we found an 8% reduction in overweight and obesity in fourth grade children. Results from Travis County supported previous findings, reinforcing that we need to coordinate our efforts with the community and that the impact of the effort is strongest in schools that implement the program more fully. I would now like to take the opportunity to highlight the tremendous work being done on the ground in a single school, T.A. Brown Elementary School in the Austin Independent School District. T.A. Brown is among the top 5 performing catch schools in the district and has taken a broad implementation approach, which includes an increase in teacher-led structured activity break periods, an increase in the number of student and teacher catch lessons, increases in communication with the parents about health, and an increase in school cafeteria promotional activities and healthy meal practices. Supporting the success at T.A. Brown is an exceptional staff, which includes one person from each grade level, an incredibly supportive administrator, and Judy Howard, the PE teacher, who is pictured on this slide. Ms. Howard leads the Catch Committee and guides the implementation of Catch, along with a very supportive and involved principal. The committee is further strengthened by a robust Catch plan, with other classroom teachers being held accountable by the Catch champion and committee, and activities that coordinate across the different components. For example, the Catch Committee was very active in sponsoring weekly Fresh Fruit Fridays, which were so successful that children got upset and called their parents if they forgot to bring fruit to schools for snack that day. One mother told us that she had to start buying fruits and vegetables midweek because her children ate all she had bought that weekend. Through all these efforts, TA Brown was able to decrease the rate of overweight and obesity from 60% to 40% in 4 years, and has recently received an HEB Healthy Campus Award that also as a result of these efforts. The success seen at TA Brown can be replicated at other schools and in other settings. We have expanded and developed other CATCH programs, such as the CATCH Early Childhood program, which focuses on preschool children and their families through daycare settings, the CATCH Middle School program, which includes a social marketing component and is currently being evaluated, and CATCH Kids Club, which is an after-school program that has been used extensively in YMCA programs across the United States. And if we could advance the slide just a little bit to see. Thank you. Through our CATCH experiences, we have learned much about what it takes to implement child obesity prevention programs. We know that it truly takes a community to make a difference, using a holistic approach which engages both individuals and environments through policies, systems, and practice to make a change. While it does take a community, it is also necessary to have strong and dedicated leadership. CATCH success in Texas was built on the efforts of both program champions, our boots on the ground, and patron saints from above. Finally, implementing child obesity programs like this require new directions and partnerships to facilitate the holistic approach I just mentioned. Our future efforts include our recently awarded Texas Childhood Obesity Research Demonstration Grant, or CORD, in which we are working across sectors silos, including coordinating with healthcare to make an impact on low-income children. Next slide. After stressing the importance of partnership, collaborations, and leadership, I cannot neglect to acknowledge the many people and organizations who have made our efforts to fight obesity in Texas possible. These are a few of the many, many individuals and organizations who have contributed to the development, funding, and evaluation of CATCH through the years.